Welcome, everyone. This is once again your host, Shailesh, bringing you live a topic that we always bring, which affects our emotional well being. And today, a topic that is so much close, particularly we think that it relates to women, so it relates to women, but actually, it relates to a human being and it's entangled with men and women. So there is no gender or anything like that in this because even though it affects women, the surroundings, the environment does affect everyone involved. So this topic is very, very close to many of the women, and it is should be a close to many of the women because they need to learn and they keep learning on their own. But today I have got this topic to discuss with me. Menopause, is it a taboo or is it a natural thing or what is it and why we should talk about it and why we should be open about it? Just like when we talk about anything and everything, like a food that we need, and different kinds of food affect our body, different kinds of things affect our health system. But also, the health system is then controlled by the system that we live in and all of the things. But menopause, is it really a taboo to not talk about it? Or this should be a normal topic, just like when we talk about naturopathy or nutrients and all those vitamins and all those things we talk that affects our body, that impacts our body. When we take a pill, when we take a tablet, whatever it is, it does affect. So when we are sick or when we are ill, so menopause is something needs to be talked and needs to be because then only we can nurture this issue or this concern that we all have. So today I have the great pleasure to invite Melita Spencer all the way. She's a Kiwi, but she's now lives in Australia. She is a real human. She's first of all, and so she's a woman as well, being a human. And it affects every woman, as I said, menopause. So she is a mother, she is a sister, she is a daughter, but she's certified life coach and a menopause coach teacher. But also, she is an advocate for many things like the disability and the learning and the management and deep in psychology she has done. So she's quite open about subjects that we generally tend to hide. And menopause is one of those topics that we generally tend to not talk about it. Either we think it is not good or either think it's a stigma, but also it has got a cultural upbringing taboo attached to it or the cultural belief system. Because when anything happens to our body and health, science is one thing, spiritual is another thing, and the culture is another thing. And all these three things, when you come, it affects this topic. So we are going to uncover a lot of things today, Melita. Let's welcome Melita Spencer all the way from Australia to talk about this topic, menopause. Is it a taboo? Let's begin with this topic, Melita. Please tell us something about why you think it is so important and at this moment of your journey that you studied, you certified, you also went to know a lot about it. So tell me something about it, the initiative, the creation that you felt that this is something that needs to be talked about.
Look, for me, it is a very personal journey, and it's been a very recent journey that I've really delved into it in a more formal way, menopause. It's not something that I spoke with my mother about growing up. It was a very quietly kept, not a secret so much. I suppose it could have been a bit of a secret, but my mother didn't talk about it. And I believe that she probably didn't talk about it with her mother as well. So when I started going through my perimenopausal symptoms, I really struggled and I thought I was going crazy. And I ended up really feeling like I don't know if I would be able to hold down my job. I wasn't sure if I could keep my relationships. I was beginning to isolate myself from other people to the point where I actually didn't even answer the phone a lot of the time. So cognitively, that really affected me. And physically, it affected me as well because I was getting the hot flashes. And I know that a lot of people talk about the hot flashes because it's a pretty evident physical symptoms are much easier to recognize and diagnose.
Absolutely.
So I sort of put two and two together and I thought, I need to see somebody about this. So I did go and see my doctor about it. Helped me immensely. Look, I highly recommend that to anybody who is experiencing this and they feel alone. Please go and see a professional about it. Start with your GP because they'll lead you to the people that you need to see, whether it's a nutritionist or a dietitian or a psychotherapist.
Yes.
There's just so many people out there that have the skills to support women like myself, but we don't do it if we don't know, right?
Exactly. So I want to see seeking that help or seeking that support or knowing that we need a support or knowing that we need to and have to have a support is a big thing because of that taboo word that comes in. Because people, there are traditional background traditions and there are cultural things to talk and not to talk or to express and not to express. Because some in cultures they think, no, you're not supposed to talk about it anything, you just sit in one corner and that's it, you have to spend your whole day, and that becomes a big use. So who do you seek help from, and how do you seek help from? That kind of thing comes in. So I want to ask you, is it a physical challenge when the woman goes through this situation, or is it a mental battle between physical and mental that they
Mm.
feel reluctant or restrictive to talk about it?
Well, I think it's a combination of both, and every
Mm,
woman's journey is unique. So every
correct.
woman experiences it differently.
Mm-hmm.
And they say between 70 and 80% of women do experience some symptoms.
Right.
And the symptoms vary. They range from emotional to physiological, and purely physical as well. And some women don't experience anything.
Sure.
Lucky them.
Mm-hmm.
So some women don't even know that they're going through perimenopause until they stop their cycle for 12
Mm-hmm.
months, at which they are diagnosed with
Right.
menopause at that time. Yes, but it has been taboo for many, many reasons.
Mm.
Societal reasons, cultural reasons, historical factors are a big one.
Correct. Yeah, historical factors. Yeah, that's true.
Yeah,
And
because,
that
yeah,
is it
sorry.
also like, is it as we say, the age gives you maturity when you are little, when you are teenage, you have thinking or you have that acceptance of your body and acceptance of your understanding of body keeps growing as you grow. But is it something that we could also say that some women don't talk about it? Maybe they have lack of maturity or lack of understanding or lack of awareness, or the traditions are taking over everything that they want to do. So they want to do, but the traditions take over, the cultures take over, you know?
Yeah, there are a lot of reasons behind that. And I think historically,
Mm-hmm.
that had a lot of influence over whether women were brave enough to speak up about what they were experiencing too.
Mm.
The term hysterical or hysteria came
Right.
from, in the early 19th and 20th century when women were institutionalized,
Mm.
and around about this age and often misdiagnosed with a lot of emotional and psychological symptoms,
Mm.
and then were diagnosed with hysteria or some of them schizophrenia or
Correct.
bipolar. I mean, there's so many misdiagnoses out there, and
True.
they believe they were punished
Mhm.
at that time. And if you look into it, they definitely were not very comfortable situations to be in.
Yeah.
And a lot of women were afraid to speak up in fear of being institutionalized and being called as hysterical.
Mm. And
Mm.
that's probably why when it becomes a taboo, because of a lot of factors that are embedded in us or been brainwashed, you can call it, or been told to us as a matter of fact. So we tend to push away and we tend to then don't talk about it because it's like a societal damage that they think, or they may not be able to live in a society if they start talking about it and things like that. So there is a huge fear because of the background that they have. Having said
Mm.
that, when we talk about taboos, there are a lot of taboos. And one of the things is your first thing is you are on your own because you have created a taboo for yourself. That's the first thing. And then the second thing is the surroundings. Then that surroundings is the immediate people that you trust, which is your family, which is your husband, which is your brothers, and all the male gender people around you. So that's another factor. So you create a taboo for yourself, then you create a taboo with these men around you. So because then you tend to fear to talk to a men, because in there, this is not men problem, this is woman problem, and it just pushed away. How do you see
Yes.
that? How do you see this coming through in the society, and what needs really to change this to accept?
Oh, yes. So, first and foremost, it would have to be open conversations with loved ones.
Hmm.
Has to start in the home, doesn't it? And if you have a
Hmm.
supportive spouse who's willing to empathize a little bit
Hmm.
and even give you a little bit of sympathy when you need it, because sometimes we all need a little bit of sympathy when
Of
we're
course,
struggling.
of course.
Um, and education and awareness to the public,
Hmm.
because a lot of people are not even aware that this is the extent of what women
Hmm.
experience when they go through menopause.
Hmm.
A lot of people just see it as a natural phase of life, and you drift in, you go through menopause, and that's the end of it. But they don't see the stepping stones and the psychological symptoms and the prevalence of it in society so much.
Hmm. Yeah, absolutely. And this one thing I wanted to ask you, since you have known a little bit about it, like, do you think that the mental health around that time, in that period, the emotional well-being takes over everything and creates a huge empty space between two humans? Do you think that's a big, big thing as a
Yes,
mental health?
I can speak only for myself.
Yeah.
I'm sure there are a lot of other women that experience this as well.
Hmm.
But it certainly put me in a state of high anxiety, which I don't recall experiencing so much in my younger life.
Mm-hmm.
Off and on, but I began living with this on a daily basis.
Right.
And it was quite debilitating.
Mm,
And like I said, I couldn't pick up a phone, make a phone call. I would avoid meetings.
mm,
Um, it would be absolutely exhausting, and I would have a lot of fatigue over it. And sometimes that fatigue was avoidance. It was, I just need to go and curl up in a ball and have a little nap, and that could also be misdiagnosed as depression. A
mm,
lot of doctors would see it as anxiety and depression. However, when I saw my doctor and she helped me, now there's lots of different ways to do this, but I
mhm,
chose to opt for hormone replacement therapy on her um, uh, recommendation.
mhm.
So when I did this, almost instantly,
Right.
I stopped having the debilitating anxiety. And it was incredible. And I really thought that it was just because I was struggling with all the things I was trying to juggle in my life, but it wasn't
Mm,
that. For me,
mhm,
it was actually hormonal, and it changed a lot of things for me. It helped me think clearly.
mm,
It helped me go through a whole day without sleeping.
mm. Yeah.
It helped me relate to people with sound mind and level head, a good level head. It helped me process information better and communicate better. I mean, it influenced so many things, and it all came down to that one thing for me,
Yeah.
cognitively.
Right. Right.
Mm.
And so, you said before the belief system for this when it happens is like, okay, is it a punishment, or is it something like you are born to happen this, or you are said? Nobody understands that that is also one of the biggest part of we call the pregnancy, so-called, and we evolve and a birth has been given to a human. And that is so relevant, this factor in your life. But maybe that has not been explained or made aware from time immemorial for the humans to understand this is a huge good part and a healthy part of your thing, not a bad or dirty or punished to be punished or something harsh to be considered that. How do you view this in the current society that we say we have developed technology, we have developed everything to take care of many medical issues that we have. And then we have this belief system which is struggling with the medical system. because the doctors might say, oh, you're punished. That means we can't do anything as a medical, you know. So how do
Mm,
you view this point of view? Because this is a big ingredient part of the taboo that we have. How do you view
mm,
this in the current society, that what really as a medical thing that you have done, and what do you think there should be a change? Medical, one thing is the science which you try to treat, and then the mind, which is what we spirits as a spiritual, we want to treat ourselves, and we want to be self-aware or self-realized of our own being as a human. There is a battle between the science and the spirituality, you know, and we
mm.
have to live with it. Basically, every human has to live with it. How do you see the medical profession in the current context needs to embrace and accept, and certain there should be certain awareness of this to be made through
Mm.
the system of medical? How do you see that?
Well, yeah, so in the past, medical assistance was focused a lot more on reproduction rather
Hmm.
than menopause, you
Yes,
know.
correct,
And as time is going on, we're evolving, we're learning a lot more about people. People are having more rights and more gender equality than they've ever had before. So
correct.
this is actually a good time to be alive for women.
Mm.
You know,
Yes, yes,
compared
yes.
to say 50 or 100 years ago. I think a lot of people might disagree with that, but I think
100%.
it's an amazing time to be alive for women, and to reframe that and look at it at a positive time. We can connect with each other, we can speak up. Women are in leadership roles now,
Mm.
that we can do
Correct.
so many things.
Mm.
And I can't speak for New Zealand, but I can talk about Australia a little bit, about workplace policies
Mm.
and frameworks that have been introduced recently. Back in 2001, which was only a few years ago, really,
Yeah.
Australia's largest trade union, which is called Australian Council of Trade Unions, called for stronger protection of women on menopause, and
Mm.
called for workplace frameworks and policies to be introduced to allow them reasonable adjustments at work for things like hot flashes or mental health and things like that. So that's been a really positive step in Australia to have.
Hmm. Right.
But it's still, as a lot of workplaces probably don't even know that's even out there, to be
Mm.
honest.
Mm.
So we do need to talk about it more, and let our employers know that,
Yeah,
to support us when we're out there in the workforce, because, it's around pregnancy a lot, and people have a lot of time off for pregnancy, which is great. And I'm an advocate for that.
yeah,
However, menopause is also a time in life where women need support from
absolutely.
male colleagues, employers as well.
Mm.
And yeah, and also, we talk about the cognitive mental health part
Mm.
of getting older as well, and that can bring us a lot of shame, a lot of
Right.
guilt.
Hmm.
um, there's a lot of stigma towards not being aesthetically pleasing anymore because we're all getting
Right.
a little bit older.
Mm. Mm.
um, there's a lot of things in societal norms and expectations around women that
Mm.
can also affect women's mental health during this time.
Mm. I agree. I agree. So it's very interesting that you said that, the age group and then the aloneness or the aloofness that comes along with it for your mental well-being. And this is something that as because one is not been talked about it as often as we would like to have a conversation on it, or even a group discussion, or even someone in the office or in a environment where you are with group of people, you feel ashamed to talk about it, or you when you are going through that, you don't even open your mouth and you just so this is something that we are talking about modern age. We talk about everything and anything on the social media today. We express our opinion. We express even if it is we don't know, even if it is fake, and we still express. But the real things like this, topics like that, why there is no groups to talk about it much. I mean, there are few, but not as obvious as we would like to. And so, when you have childbirth, there is a group of mothers, there is a group of those prenatal classes and all that when these women come together. But then they don't come together as a group for this topic, which is still considered among themselves as a taboo. That needs to
Mm.
quite drastically I guess, needs to be changed to really for the better environment and better health of the woman. I want to, yeah, you mentioned about the husband, and I want to explain how do women youth feel in your experience or in your knowledge that they can communicate with their near ones and dear ones and the loved ones, particularly your husband, and then also your mom and dad and everyone, which they know, mom and dad, we are still okay. But, then even for with the brothers, even with the other friends, we feel shy to talk about it. But I want to know from you, like, husband is one of the things that people do get shy about it. How do you think they should communicate as a woman in your experience? How do you feel it should be open about it? It's a big stick.
Well, yeah, look, I think a lot of women do feel like they're being dismissed or
Mm,
stigmatized when they talk about these things. It also
yeah.
places women in a very vulnerable position,
Mm,
and a fear of judgment or being ostracized in society at that point. When it comes to home, I highly recommend and encourage open dialogue with
mm,
family members. It needs to be done in a very natural way.
mm,
Um, Look, it wasn't done like that in my household.
right.
And I had an interesting conversation with my sons once I
Mhm.
had my good old
Right.
estrogen patches.
Right.
And I have two teenage sons at home. And, I really struggled with the irritability and that sort of thing. So my poor children were experiencing the other end of it, even
Mm,
though I was I'm always very mindful of how I speak to them and that sort of thing, but I was a lot shorter and probably not as patient as I would normally naturally be. So
right.
I did have a nice little conversation with my sons about it. They were so understanding.
Mm,
They really took me by surprise, and I wish I'd done it sooner. So
right.
now we talk about it very openly, and I
Mm.
want them to know this because one day they may become somebody's husband
Yes.
or
Yeah, correct.
somebody's dad,
Mm-hmm.
and I really want them to be the best men that they can be.
Mm.
So,
Yeah.
as a mother, to
Yeah.
have this open communication with my children is vital. It's it's my life's work is my children, and I want to do the best job I can, and this is part of it.
Yeah.
Um, I don't want them to have any surprises, and I certainly don't want them to go into relationships and have it falling apart because I haven't done my duty and given them some, understanding behind the woman's journey.
Absolutely, absolutely. And this is something starts from your own home, isn't it? Basically from your with your own people. And that's where the conversation and the communication to should really be starting from there. Then we can embrace more and more in the society, and we don't feel any stigma or any taboo about talking about it, even in a
Mm-hmm.
group of events. I mean, we do have events on women empowerment and women this. Then why don't we have events on menopause? Why don't we
Mm.
awareness events like that? Because this is could be a great event to bring people together to make understand them the importance. And in that, when you involve the other genders, then obviously it becomes a great community kind of a cohesive, integration, social integration step. So, it's very interesting. So, why do you think that, when when people feel it's a stigma because one, they don't understand what is menopause, and they have no pre-knowledge, so they can make assumptions. Oh, it means pregnancy. Some people may think, is it pregnancies or is it what happening now? Is it she going to give a birth? Is that a sign or what? All those unnecessarily misconceptions come into the mind. And
Mm.
to do that, that's why. How do you see this societal changes of such a huge stigma going for many, many years? It's not like something you can take a leaf and overnight change. However, to change,
Mm.
if you want, the mindset can be changed, but mindset is the huge aspect of every human that you can't do
Mm.
changing everyone's mind because that's their mind. So, how do you see to make a change or to bring a change with regard to this that we can approach, or in your view, how they can approach?
Well, I do believe that, when we come back to our discussions that we have in our families are super
Mhm.
important. Our
Mhm.
workplaces are super important.
Yeah,
Our political stances and medical
yeah.
um, are very important. But at the end of the day, it comes into our networking groups,
Mm.
and it's an interesting thing. I had a chat with a friend of mine the other day, and she's going through perimenopause at the moment.
Yeah.
And she said that she tries to remember that she was perfectly fine before she
Mm.
hit puberty, and she will be fine again one day. And I
Yeah.
love that because sometimes we feel as women that we're going into the unknown.
Yes.
Um, but in actual fact, we were there as children.
Yeah.
We hit puberty. A lot of people talk about puberty and the increase of estrogen and women's bodies and going through productive cycles, and then the estrogen begins to drop very erratically during perimenopause, which causes all the ups and downs and all the symptoms and things like that.
Yeah.
And then eventually that subsides and it stops and it levels out again. So it's actually something really exciting to look forward to. At the end of the day, it's like the next chapter of
Mm.
life.
Yeah. And that's why when, menopause is not something related to only physical, but it also has got physical, mental well-being, and, and then it attached with medicines or temporary herbal medicines, because in those days, that's where they were used rather than any antibiotic, because this is not a sickness. This is not something like a disease or anything. And this is where how differentiation between what is this and how it is treated. Is it treated like a medically thing, or is it treated like a normal human journey as a spiritual being? That becomes a challenge. How do you view that as a challenge when it comes to medically treated, or when it comes to giving someone
Yeah.
traditional solutions to
Well,
or
yes.
minimizing your pain, or minimizing your anxiety, or minimizing your mental health?
Yes, and I believe that we really need to make sure that our doctors are trained in this area
Hmm.
because there's so many misdiagnoses,
Hmm.
and people are they have medicines prescribed to them for different things, which may
Mm.
band-aid or subside some of the symptoms of menopause. But
Mhm.
holistically, there are a lot of natural remedies out there too that can make it a little lighter, the journey.
Mm.
So there's different ways of doing that as well.
Mm.
We can talk about diet as ways to go about it. We have to consider that family genetics influence menopause greatly. There's also surgical menopause, such
Mhm.
as if a woman might have a hysterectomy before
Yeah,
they naturally enter perimenopause or menopause stage.
right.
And they might need the support of medications or they might not. And it all depends on the woman's journey at the end of the day and what works best for them, and also to support their spiritual beliefs, because there are a lot of cultures and spirituality factors out there that influence whether a woman is willing to um, use certain interventions to
Yeah,
support them.
yeah, yeah. And I think one of the things also I want to draw this conclusion, since you being a woman, and you have experienced it, and you experience, and we all women experience this. And as you said rightly, that everybody struggles in a different way and understands in a different way, but that also the contributing factor to that is their mindset. It's there to their belief system. If you have to like draw how do you see that this is a physical situation for you as a woman, or is it a mental situation for you as a woman? That it is our mindset, because when you try to explain someone, you always say that, oh, don't worry, everything is all right. It'll be okay. But is that the right way to say, or rather than saying that, look, this is what you should do, and this is what I have experienced? This is quite a fine line that to break the taboo, because when you get away and avoid to explain anything to anyone about this, or even to your colleagues or to your peers who are facing this, you just say that, oh no, everything will go away, the problem will go away. Or how do you
Yeah.
see this as a
Sometimes it's an internal battle.
Yeah.
You know, the battle is inside us,
Hmm.
and it's going to reflect on our belief systems, what we've
Yes.
experienced in the past, the society that we live in, the
Mm-hmm.
community that we have, the networking that we have, and the limitations that we put on ourselves as well, and how we are going to um, respond to whatever life
Yeah.
throws at us once we do um, share about what we're going through. And we need to be prepared for that. And I think that groups of women in particular, and not to keep men out of the conversation at all, but it's super important for women to have a networking system together to
Mm.
help emphasize and empathize with each other, and validate each other's experiences, and to know that we're not alone, because it's extremely isolating. We
Absolutely.
do that to ourselves,
Yes.
but partially because there is a fear there of vulnerability. There's a fear of being judged, or you know, in the workplace as well, but particularly by in my experience, males, because part of that is that they just lack the understanding sometimes.
Yeah.
So if we can get the males on board and to support these women, that would be amazing.
Yeah, you rightly said before also, like, the healthcare, the employers, the office environment work, the families and the professionals, the medical system and the media and the general public, everyone, if you look at it, they become a barrier rather than they became a good soul kind of supporter. And this is very, as being into my own media, I would understand when I speak to people in different things. It's so much out there to be supported rather than not supported. And the actions taken by these professionals, families, employers, everyone is all towards the negative side of the human life rather than the positive side of the human life. Recently report there was that in UK, this is still a stigma. 83% of women still feel menopause is a stigma with associated with the menopause. So it's huge work in the societal or in a human journey or in a woman's journey to change this from lowest of, like, okay, you can easily ask support when you cough and sneeze, you go to a doctor, you seek advice, simple thing. But when you have menopause, you don't even bother to go because of the stigma around it. And that is a real shame, or is a real sad thing, when you have all the technology to support you, all the medical
Mm.
equipments to support you, and you are pushing away and you are getting away from it. That mindset, how do you see, needs to be changed drastically? How do you see the societal changes that can happen? As you rightly said before, that it starts from your family. You start talking to the kids at an early age, or when they are conscious about these things. That's very important. But when it comes to, like, as you said, in Australia and New Zealand is not that far. However, Australia has developed and made some good progress on it, as you said. But
Mm.
New Zealand is still probably not. We don't know much about that here. However, as an obvious thing to know, like, I don't say that it has to be told in the media, like, oh, this is what you do and this is what you do. But there are so many ways of doing and passing this positive information and awareness. And I think we talk about breast cancer awareness, we talk about other awareness week, we say mental health awareness. So
Mm.
why don't we have this menopause awareness? What do you think about that? Should we?
Yeah, I'm actually really happy to hear, you know, that mental health has become not so taboo.
Yeah,
You know, even
true,
20 years ago, it was still taboo.
true.
You know,
Very
if you
true.
felt a little bit different, whatever that could be,
Mm.
people were very quick to label, and it was like a sickness, I suppose. And in a way, it is a sickness,
Yeah.
and we need support around that. However, menopause is not a sickness,
Mm.
but the symptoms can mimic the
Mhm.
sicknesses that we experience like that.
Mm.
And at the end of the day, as people, we only really seek out things when we really need them, don't we?
That, yeah,
So,
true.
you know, at some point, all women are going through menopause. So at some point, they're going to be seeking out some support with friends or family or doing their own research. And you're right, we have technology at our fingertips now.
Yeah.
There are groups for women that support them, and I have a Facebook group called the Menopause Mastery Circle. But there is also a summit coming up in 21st, I think, of January, that you could probably research into, Google into for the women out there. That has a lot of doctors speaking on different topics of menopause, and it's free, which I think is wonderful, because also financially that will stop a lot of people from going out and seeking support around this. But at the end of the day, women need to be kind to themselves.
Yeah.
It's don't beat ourselves up about going through these things that are perfectly natural and perfectly expected.
Yeah. But the thing with that, you're absolutely right on it. But then when it comes to like behavioral changes during menopause, that obviously people see it, but they don't understand it, but they just see it on the surface of it, but they don't know inside what's happening. So this anxiety, the depression, the mood swings that we see, we don't accept it as boldly or as holistically, you
No,
know?
and it's not really acceptable to behave erratically in the community.
Yes,
you know,
true. Yeah,
so if these women are running around, being very
yeah.
moody and irritable and irrational, it's not acceptable, and it's understandable why they're stigmatized
Yes,
around it.
correct.
But I think if we really were in touch with ourselves, our feminine selves, we would be able to recognize these symptoms if we were expecting them. And that's why education is so important around it.
Yeah.
If we're not expecting it, it really does take us by surprise. And it can be very scary, because we don't know where it's coming from. We're looking for answers in places that probably don't have the right answers for us. And it's important that we have those networking groups with other women so we can make sense of what's happening in our
Right.
world during this time.
Absolutely, absolutely. So do you think one of the things also as a mental health, as a health certified that coach you are also, do you think the food also affects during this time, which again affects our bodily needs that is required to?
100%. Alcohol, in particular,
Okay. Yeah.
is not friendly for people going through menopause.
Right. Okay.
Obviously, smoking can bring on early menopause as well.
Yeah.
And processed foods can bring on early menopause. I mean, there's a lot of factors to do with menopause. I mean, it's age related. There's ovarian reserve and function, hormonal levels, obviously, genetics play a vital role in when menopause onsets. And also the food. The food is just a sub element.
Right, right. Okay. So, and then again, you talked about, so one is the food, but also the age factor. Like certain women experience at certain age a different kind of experience they have, and a different anxiety, different depression, or different bad expectation. And that again may plays an important role when you are with your husband. Because if you are into a certain age, your husband can understand and accept it, but in certain age, then you don't. And how do you see that, as you mentioned also, like, that's can create homelessness or aloneness or aloofness for women if there is not enough support from their own husband or partner.
Yeah, I think that would be very lonely,
Mm-hmm.
and a little bit scary.
Right.
And it could even affect uh, the intimacy of the relationship as well, because menopause also affects libido. So,
Yeah.
there's other factors in play here.
Yeah.
And you can imagine that the husband might be a little bit wondering what's going on here, and
Mhm.
self-reflective, and possibly wondering if it's something else,
Right.
when it might simply be a drop in the hormones,
Yeah.
and something that they could communicate effectively about, and do
Hmm.
some restoration in the relationship.
So, in your experience, what is the best method or therapy? Is it hormonal? They can go through the hormonal therapy as well. And so, do you think without hormonal replacement therapy or to live during that time and to manage that time, or you should go through that procedure or situation with the medical? How do you see this natural process? And there is certain way of doing things with your own mind, with your own capability,
Mm.
capacity. It differs, right?
Oh, yes. And every woman's journey is different and unique. And some women may opt for that
Yeah.
support and some will not. However, growing up, I was not an advocate for
Mhm.
medicinal things
Right.
unless it was absolutely urgent and there was no other option.
Mm-hmm.
But I have seen quality of life change. And so, therefore, I have chosen that for myself. However, it may not be appropriate for somebody else.
Mm-hmm. Right. Yeah, because normally medically the doctor's role is to avoid that any procedure, any surgery, they avoid for any kind of things, whether it is cancer or this and then. And then certain things they have to take those drastic steps. So now you have to go through that surgical process. But prima facie for menopause is not something life and death kind of situation in all probabilities. It is more about the managing the time during that time
Mm.
becomes
It
what is
feels it
Mhm.
feels sometimes like life and death.
Is it? Yeah.
If you don't know what to expect,
Hmm.
it really does, and it can be very scary.
Right. Okay.
To debilitating anxiety,
Hmm.
the hot flashes. I mean, some of those symptoms are also symptoms of other types of medical conditions. So
Hmm.
sometimes our minds can go wondering, could it be this? Could it be that? And we try to self diagnose and then we get into a panic and then we use Google and try to work out what's going on with us. And then we scare ourselves. So sometimes it does feel like life and death.
Mm.
Um, so
Yes.
it's good to see your GP. It's definitely a good place to start.
Yeah, and I know, well, I think when some of the Hollywood celebrities also mentioned about that, that earlier you should, if you feel that you had to take, then you should seek immediate medical advice and take those. And I think Gwyneth Paltrow was quite advocate for that, if I'm not wrong, maybe wrong. But yeah, but I know. So how do you, when it comes to advocacy, you want to tell to all the listeners who are listening, if you want to advocate and as an advocator for menopause taboo that we are talking today, what really should be in your world or in your view that for all the listeners who are listening, and particularly the women, they need to take, or what's your advice to them, if I ask you?
Look, as you said, we are all human beings, and every
Yes,
woman and every man on this planet is a human being.
absolutely.
And we're all going through our own experiences.
Mm.
But we are also social beings as
Yes.
human beings, and we want to belong and we want to be a part of something bigger than ourselves.
Yeah, yeah.
And to be able to promote this is to connect with each other,
Mm. Mm.
communicate effectively with each other, love
Yeah.
each other, support each other. And sometimes we need somebody to step up when we can't,
Mm.
and it doesn't matter if it's the husband or the wife. If
Absolutely.
somebody is having difficulty in any part of
Mhm.
a relationship,
Right.
sometimes we need to step up for each other and advocate and support each other as well. We need friends, we need family, and we need a network.
Yeah, absolutely, absolutely. So seeking help, seeking guidance or advice is not a shame or anything guilt. It's you shouldn't be considered that just because people don't talk about it. And at this current stage, not many people talk about it. So people have got the perception, whether it's man or woman, they have a perception because there is nothing talked about it in the obvious way on the surface in the community.
Mm.
People think that that's not to be talked, or that's never to be talked, or that's always remain like that. And then we don't see any societal or community changes with regard to this topic, which is the taboo.
Mm.
It becomes more and more taboo, deeper. and more people suffer because of that. And I think one needs to understand that this is one of the topic where people have got a role as a humans to reduce the sufferings, no matter whatever that sufferings are, whether it is medically or whether it is mentally or whether it is physically. We are all here to as help and support and lessen the sufferings, right?
Mm.
In that context, how do you see, that is being an advocate for yourself and but also being an advocate for this huge topic that we came today with. I think it's amazing awareness that I learned a little bit about it as well in terms of how I can advocate this, how I can promote this as a positive thing. And it's not something unhealthy. Menopause is not
Mm.
unhealthy. Menopause is not dirty, if you want to say, or a stigma like a or like a what they call it, the punishable offense that you have had.
Mm. Mm.
These are some of the factors that came to me that after talking to you, Melita, this is such a huge topic and also such a huge work to be done. How do you see, in the future from now on, you, I hope you will, I'm sure you are continuing to advocate this, but to make it more and more better, what's your final message to all the women out there who are listening to this? That what do they, two basic things to start, putting on the surface rather than under the surface. At the moment, it's not on the surface, this topic. What would you?
Connect. I look, my recommendation and suggestion for women, and I know that this is wonderful because it's worked for me, is
Hmm.
to connect. Connect with other women.
Mm-hmm.
Know that you're not alone.
Mm.
Be kind to yourself.
Mm.
This is a really great time for self-reflection and
Yeah.
growth, which I love. And it's a really good time when you are self-reflecting to prioritize different things in your life.
Yeah.
It changes your outlook on life, and it's actually a really exciting time.
Mm.
This is the next chapter. This is usually when your kids are, just about leaving home, or
Yes.
if you don't have kids, that's okay, but it could be a career
Mm.
journey as well. And it's a freedom,
Mm. Absolutely.
it's
Freedom.
it's an exciting time in life. And I know that a lot of women do a lot of traveling at this time,
Yes.
solo traveling too, which
Yes.
is a really great way to be in touch with yourself
Mm.
and meet other people and really, live your best life and
Mm.
spread the message.
Mm. I agree. Very well. Thank you so much, Melita. This is amazing topic that we did today. But I want to touch and get your viewpoint as well on this. That the final from me, what I understood is, don't watch others going through this pain or sufferings. Do something about it. That would be my kind of understanding after hearing to you. We go to watch a movie, we saw a lot of things that are tabooed or that is a taboo in the society. But when it's displayed in the movie, we watch it very humorously or seriously or jokingly, but we watch it and then we talk about it.
Mm.
But when it comes to real life, when it comes to real living with different people around us, and when we see these things, we don't talk about it. We just keep quiet. So I think that's something that summarizes me for me is like, real life and real life, they're two different things. So in real life, you can watch it, but in real life, you have to action it and you have to talk about it, basically. That will be my message to everyone that are watching today this beautiful topic. And finally, it is not a taboo until you say it is taboo. If you break it, you can break it. And this is where we humans are capable of breaking all the biases because we experience everything and then we change from those experiences to make better experiences and move forward for
Mm.
everyone and anyone around in this world. So I take your point, Melita, that it's amazingly what you said is like, seek advice, seek help but also medically. And as you rightly said, it can be life and death. So if it is can be life and death, then be serious about your own life and death. And I think everybody has a role to play in it, not just women. Just because it is attached to women doesn't mean that it is a role to play by only women, because we are humans first before we are men and women. So with that note, Melita, I thank you absolutely very much. Thank you for this beautiful topic and your visions and your ideas of understanding and giving these insights to our listeners. Final message from you, and we will end here and we will bring you back to some other uncanny taboos like topics that needs to be told to everyone. What's your final word on
I
this?
just want to say thank you so much for having me. I appreciate an opportunity to share with the public as well,
Yeah,
because this is something that's very close to my heart.
yeah.
And I love all people. You
Hmm.
know, the men need to know because it will help them. The women need to know because it will help them. There's nothing negative that can come about sharing this information. Only positive to come from this. So thank you again, Shailesh.
Absolutely, absolutely. Very well said. It is all positive talks, it is all positive changes that we want to make, and we all want to do that. So, all the listeners, please write to us if you need any, seek any help, advice, idea, feedback that you want to give us. Please do that, and we will pass on to Melita, who can be happy to answer your questions as well in whatever best way we could. With that note, I take and bye for everyone, and we'll come back once again in the new year with another topics like that, which we say it is taboo, but we talk about it, so it's not a taboo anymore. Menopause taboo topic is not a taboo anymore in my world from now on. Thank you, Melita.
Thank you.